Good evening. Good evening, everyone. Hello. Are there less people on the 6 o'clock session than on the opening plenary? Some people are already getting ready for the finish night. Welcome, everyone. I'm Charlotte Marchandise. I'm the Executive Director of EUPHA and EPH. EUPHA is European Public Health Association. We're really happy to welcome you tonight with a great panel we will introduce with my co-moderators, Dr. Domitilla Marconi, who is also representative of EUPHAnxt, our youth network and young professional network, and Dr. Alexandra Frețian, researchers at TU Munich and at the WHO Collaborating Center for Health Literacy. And so that everyone is well aware, because I heard some people didn't know what are the WHO Collaborating Center. There are 800 globally, and they are institutions that works with WHO to turn science into action and connect research to real-world impact and inform the ministries. Now you're well informed. We are living in a time where information travels faster than understanding, where opinion trends faster than evidence. And public health, we stand right in the middle of this storm. But we know that the conversation is not about correcting falsehood or bringing more and more evidence and more data to policymakers. Is it working? Not so much. So during our preparation, we agreed to be both humble and bold. Because we don't know everything, and that's why researchers are still searching. But what we know is that we need trust. And we've been looking up in the European Journal of Public Health and in many literature, and some people have been telling me again and again that the main thing they want to talk about is to rebuild trust. And if we want to rebuild trust, we need to tell the story about science really progress through doubt, through debate, and through correction, and then consolidated evidence. And we also agreed that we will not agree on everything, and that debate is positive and good for science. So we want to rebuild trust, trust in institutions, trust in science, trust in each other. So tonight is not about them, the misinformed people, and us, the scientific community. It's about us as scientific community and people, and dealing with debates, dealing with problems, dealing with science that we don't know really how to deal with. It's about us trying to engage with controversies. The French sociologist Bruno Latour has this approach of controversies that more than a disagreement. It's a way to study complex issues by tracing who is involved, what evidence they bring, or what ideology they bring, or what commercial interest they bring, and how the debate unfolds in public space. It helps to understand how knowledge and opinions are built, and not judge the end product, but see all the process, and think critically when facing misinformation, disinformation, and uncertainty. So through all the session, we'd like to hear you from the Slido. You know the drill. I would like to start by asking you which controversy you have personally or professionally encountered. Some of these topics may be easy to address. I think on vaccination, we're kind of on the same page, all of us, but not all of us, not all of the controversy. For instance, I know lots of us wear nail polish, and we have quite a good evidence that nail polish is not that good for health. So please answer for that on the controversy, and then Domitilla will take the interactive part. And the next question was also, and you can answer both for the controversy you selected, what was harder to answer so that we can build something at the end of the plenary. Now, Alexandra, I'll leave you the floor for some key concepts.
Thanks a lot, Charlotte. Let's dive into it. Fake news, conspiracy theories, misinformation. These terms dominate headlines, whether it's about politics, health, or crises. The problem isn't only their existence, but the speed and scale at which they spread. A study found that false information on social media spreads 70% faster than factual information. But what do these terms like fake news and conspiracy theories actually refer to? Claire Wardle has categorized different types of misleading information. And for today's session, I'd like to focus on two of them: misinformation and disinformation. Both involve false information, but with very different intentions. Misinformation is false information shared without harmful intent. We all saw this during the pandemic, when home remedies and quick cures were circulating everywhere. Even if shared with good intentions, they can delay proper treatment and strain health systems. The same holds true for disinformation. However, this type of false information is shared deliberately to cause harm or mislead. In Europe, political actors have exploited health narratives to mobilize support, cultivate uncertainty, and deepen divides. From coordinated anti-vaccine campaigns to deliberate efforts to erode trust in health authorities, these were not random acts. Disinformation and distrust don't appear out of nowhere. They thrive in political climates of polarization. And when politics and disinformation intertwine, public health becomes collateral damage in ideological battles. This makes people lose trust. And once lost, even the best evidence loses its power. So disinformation isn't just a threat to public health, but a threat to the very foundations of democracy. So yeah, now turning to the question, what can we actually do? A very tough one. As always, no single measure is enough. To start off, a part of the solution is strengthening media and information literacy, which help us understand how algorithms work and influence what we see. Social media platforms feed us more of what we already believe, keeping us comfortable in our echo chambers. When it comes to public health, investing in health literacy is also crucial to support people in assessing health claims critically and helping them understand, appraise, and apply health information, both online and offline. Together, these literacies act like a kind of social immunity. They don't stop the infection of falsehood completely, but they make societies more resilient to it. And yet this alone isn't enough. We also must make the information landscape easier to navigate. We can leverage AI to detect and slow the spread of misinformation on social media platforms. And at a policy level, we need stronger transparency and accountability, requiring platforms to disclose how their recommendation algorithms work. In this session, we'll explore these and other approaches further, get inspired by the success stories of our speakers, and just as importantly, as Charlotte already mentioned in the beginning, acknowledge that we do not have all the answers. While there are many things we do know, there are lots of others still to be found out. And with that, I'll hand back to Charlotte.
You bring back the... We'll stay here. So, one of the things is that we know when we engage with policymakers that they want sometimes certainty, they want to know. And when they disseminate to the public, they want to know, they want to say something certain. And we've seen the limits of that when we went for COVID. So we'd like to know what is the hardest part for you to communicate uncertainty. And there are so many topics that we're not certain, and that's sometimes something that is blocking to build the bridges between science and policy, and science and population. Now I would like to share a video from Dr. Seema Yasmin. She could not come tonight. She's from Stanford, but she lives in Los Angeles, and she's disease detective at CDC. She's also an author of fiction and scientific paper. Her work shows that trust in public health does not collapse only because of misinformation from bad actors. It also erodes when well-meaning leaders communicate without transparency, humility, or evidence-based methods. She argues that communication is itself a science and that should be taught and practiced with empathy, listening, and what she calls radical transparency. She's also fighting really strongly the anti-science movement in the US, and you will see she's in Instagram and also developing very innovative way of communicating science.
Hi everyone, I am Seema Yasmin. I am so sad that I can't be there with you in person at this incredible conference. I can't travel at the moment and I'm currently in Los Angeles, California, where I am working on my 1-hour stand-up comedy special. Because yes, I was a hospital doctor in London, and here in America, I do comedy. I could make many jokes about being a public health physician in America and how stand-up comedy right now in these tumultuous anti-science times is giving me much more joy and bringing me perhaps even more career stability and better career prospects. Because here we are. When I am not on stage making jokes, I am a professor at Stanford where I study the spread of anti-science misinformation and disinformation, the growth of anti-vaccine movements, and where I teach evidence-based strategies for building cognitive resilience against propaganda. I'm very invested in how we nurture future generations to not fall for the anti-science propaganda. I never in a million years thought that my career, that my training in medicine and epidemiology and public health would bring me here to literally putting on a red nose at times and doing clowning and stand-up comedy. But wow, have I learned how laughter and storytelling are the shortest bridges to connection. And gosh, do we need those tools and strategies now? So while you are having these very erudite conversations about public health in these times, I also implore you to think creatively and with ingenuity as to all the parts of you that you can bring to this fight. And also ways that you can safeguard your own well-being, your own mental health as you work in this field. I hope that we can all stay in touch beyond this gathering. Please find me on Instagram. I'm at Dr. Seema Yasmin. You can see my stand-up and my clowning as well as my other more serious sides. And I would love to learn from you all and to keep this conversation going. Have a fantastic conference and thank you to all of you for all that you are doing to bolster and protect public health.
That's such a refreshing perspective, combining humor and health, right? Beyond the question of how we can communicate more effectively, there's another important question. Where do people get their science and health information from? And that's exactly what we want to know from you. While we've highlighted the dangers of disinformation so far, we also can't ignore that these platforms are vital spaces for sharing health information. That's why I was fascinated to learn that YouTube has launched an initiative featuring only credible evidence-based information. And I'd like to welcome Gigi, the head of YouTube Health in Germany, to enlighten us about this initiative.
First, quick question to the tech people. Can we get our voices on stage? Because we can barely hear each other. That would be super helpful. Thank you. Thanks for having me. What I would love to do is give a bit of an insight of what we see at YouTube. Let me try something first. Who in the audience has used YouTube before? Maybe raise of hands. I think there is a minority that is familiar with the platform. And who of you is familiar with YouTube Health? Oh, I think I need to go. So let me give you a little bit of an update on YouTube Health because that might be helpful. At YouTube, we see that since years, increasing amount of people are coming to the platform to search for health information. to give you a number, because you know my employer is not uninterested in numbers. Globally, just on YouTube, just last year, no Google search involved, just strictly on YouTube, health condition-based video views, so people looking for oral cancer, polycystic kidney disease, mental health issues, like real medical issues. We had 300 billion views on pieces of content. In Germany, I have about 3 billion views a year. So there's a tremendous interest of the whole population, and we have the whole demographic from very young people to very old people wanting to inform themselves about health information. So the platform doesn't create any content. So we match, when you search for a condition or for health information, we match you with a video piece. And that could be from a public organization, an institution, an organization, or a medical individual. So YouTube Health, which seemed not to be familiar to many of you, is based around criteria that we received from the WHO and the National Academy of Medicine, for those from the US, and the NHS from the UK, that allows us to identify credible sources of health information on the platform, and which we then indicate under their pieces of content. For instance, I come from Berlin, so we have Charité Hospital, which is the biggest hospital in Europe, and they have a YouTube channel. So underneath their channel, it would say, this is from a public hospital in Germany, or statutory health insurance as such. So that when you watch the video, you have an understanding who is giving me that information, by which real-life health credibility. And secondly, the criteria of the WHO for that we use also gives us evidence-based, et cetera, et cetera. So this allows us to kind of surface and support the proper health information when people look for it. And at the same time, of course, we had disinformation and misinformation on the screen, so I'd love to speak to that. In each country that YouTube works in, that's over 100 countries, we use the local law, we use child protection law, and then we have platform rules that we use, and we have medical rules that we use to moderate or look at the content and see what is appropriate information and what might not be, and what might need to be taken down from the platform. So whenever a medical information piece of video is on the platform, and it is violating one or more of those rules, it now will be removed before it gets to 10 views. So it's gone. In Europe, I think last year we removed a few million videos just on health. And how do we do this? Because on YouTube, every minute, 500 million minutes of materials uploaded. So it's humongous numbers. Sometimes I have to write it down to even understand the number. So we use machine learning, of course. We use AI. We use human review, and we use third-party organizations, what we call trusted flaggers. Usually that would be NGOs or non-for-profits, that we ask them, please monitor the platform on bad content. So on the one hand, to make it quick, we surface the good stuff, we label the good stuff. This is based on WHO criteria. And then on the other hand, we're weeding the weeds and trying to get the bad stuff out. Because, coming back to the beginning and your question, there's a humongous interest of people in health information. And we're trying to kind of make sure that the proper health information, by most of the time, I would say you guys, because it's the institutions, it's the big hospitals, et cetera, that provide it, to match that up so that people are able to see proper information when they want to, inform themselves about health or make it part of their health journey and things like that.
Thank you very much. Yeah. Please wait for the end of the plenary to connect on YouTube Health. Now let's turn to our local speaker, Sanna Vesikansa. Kiitos. You're Director of Crisis Help Activity at MIELI, Mental Health Finland, but you're also the former Deputy Mayor of Social Service and Healthcare here in Helsinki. we know that we want to support researchers and institutions to engage more with people, with interventional research, citizen science and all that, because we need to have trusted community. And we need to have people talking to the community on behalf of science, because, I mean, not all of you have an Instagram channel already, or not all of you are going to do stand-up comedy. So you need peers. We'd like to know who are the most trusted messengers in your communities, and we have a plan on that. We'd like to see how we, as global public health people, we can reach more to these people. I would like to hear from you what you're doing and what we can learn from your experience.
Thank you, and hello everyone. I think it's an interesting question, who are the most trusted messengers? Probably all of those in certain things. And what we know from, so I'm coming from the NGO called Mental Health Finland, and we have a lot of also crisis help. We meet 100,000 people on the phone every year, 150,000 altogether in Finland. And I think from those experiences, we know that still the family members, the peers, also the kind of traditional authoritarians, let's say teachers or nurses, they are very important. But of course, more and more also, people seek information in the internet or media, and maybe traditional media use is declining everywhere in Europe. So, for that, it's going for more maybe fragmented to the YouTube or other sources. So very important, of course, is to know if it's based on scientific knowledge or just attitudes or thoughts. But in your list, I think it was very important also during the COVID, when I was the deputy mayor here in Helsinki at that time, also to understand that there are so many different groups living also in a big city like us, that, for instance, when we were talking about COVID and how to protect, how to then also work with the faith and community leaders in people's own language, how to really reach out. It was really difficult, of course, because we couldn't really have the big meetings and it was difficult to organize. But we learned a lot from other cities that were doing it, that I think still the traditional way also in Helsinki and probably elsewhere as well is that we have been used to the fact that professionals are trusted, and it's a new thing that you need to use other means of really going to the people. But this question of trust, it's so important because it's so much attached to the fact of mental resilience, and mental resilience is so important in this time in our open societies like ours. It is the glue that brings us together. I think especially now when here in Finland, probably everywhere in Europe, people are very worried about the global politics, Russian attack to Ukraine. Not only that, but it came very fast after COVID, and at least for Finland it was, we didn't really get through the COVID when we were already in a war mode, and how to really strengthen the mental resilience in a times that feels that it's a continuous crisis, not to talk about the environmental crisis or climate that we are now trying to negotiate what to do with that. So how to really have a certain really action to gain more trust in each other, in the knowledge, in the use of media, at the same time as we know that there is also kind of breakers that do it with a purpose, use bots or campaigns. I'm sure also in the audience there are researchers that maybe have had the even personal harassment or targeted harassment, and it's also us NGOs, we have experienced it. I'm sure also the media people has as well, or for instance, of course, how that is used in a very similar way in every country. I think that is something that we should really think about what we can do together, that we wouldn't just be a target one by one. Is it one individual scientist or one individual subject, but how to really know what's happening also in the kind of intense, violent campaigns like that. It's important for the democracy, because otherwise I think our societies also depend that people are active and they are also taking part of decision making. And as a former politician, I'm not longer anymore involved. I was 16 years in the city council in Helsinki, and now I thought I'll do something else for a while. Maybe this is also then going back of that times. But I think I'm very worried that since politics is not also something that people dream about, it's something that they fear about. Can I go to put myself as a politician? And also in Finland we see that it's the least popular when you look. Police and army are thought very highly, but then politicians not so much, and we depend on that so much. So some thoughts for the discussion.
Thank you very much, Sanna. For me, the takeaway from your presentation was that we need to ask ourselves how we can rebuild that trust. So I guess everybody needs to think about how we can restore that in public health. Now we're moving on to another topic, and thinking about the food we eat, the medicine we take. Commercials and advertisements shape our behavior, and often we don't even realize it. So we'd like the audience to take a moment and reflect on the areas where commercial narratives have the strongest impact, a negative impact in our lives. To unpack this loaded topic, I'm very excited to introduce the WHO lead on economic and commercial determinants of health, Monika Kosinska.
Thank you very much, but actually I have a new job. So I have to say, this is one of my first speaking engagements in my new position, which I started last week, which is the one that's on the screen. So I'm now the WHO's global technical lead on social determinants of health equity, which includes the portfolio on economic and commercial determinants, but it also goes more broad than that. And one of the things that I wanted us to do, if I may, is to take the conversation into some of the implicit aspects of what we've been talking about, and that is the structural dimension, the structural determinant that comes through the digital transformation, if you will, which of course underpins the conversation that we're having around trust, around misinformation, and so on. And we've spent decades now as a community, some of us literally, and I include myself in that, in learning and researching on the social determinants of health, which of course, I don't need to tell anyone here, but it is the conditions in which we are born, grow, live, work, and age, but also the power structures that shape these conditions. And I think one of the things that we have to face is that our social life, our social conditions are now increasingly and irreversibly digital. And with that, this brings in this new layer of digital determinants of health. And forgive me for using the technocratic terminology, but it becomes quite important when we think about this as a field of public health inquiry and how we in this room, whether we're researchers, whether we're practitioners or policymakers, how we structure and understand the work that we undertake in order to bring about change within it. And because it's not just the technology that we're talking about, it's the systems of access, of power, and of profit that decide who benefits and who is left behind. And part of the discourse that we're having on misinformation, on gaps in trust, is emerging from this inequality. And this digital inequality reflects our societies. This is not something that is different or new. This reflects the inequalities within our societies, the politics within our societies, societies, and indeed the priorities within our societies, what we have collectively decided matters. And WHO's Global Strategy on Digital Health tells us that digital transformation must advance equity and the right to health. And I think a question for us is, how far are we towards that goal? Here in the European region, the WHO, my fantastic colleagues in the European office, together with LSE in 2024, published a study that showed 127 digital factors impact our health. This includes internet access, data governance, algorithmic bias, and of course, misinformation. And this is enormous. But the message isn't about digital tools, it's really about power. And digital determinants, they shape who is visible, who is counted, who has a voice. And this was reflected in the World Report on Social Determinants of Health Equity, which was published in May this year. Digital determinants, they interact and they amplify the social, commercial and political determinants that already define our choices and the conditions that shape our health. So if we think about the social dimension in this digital age, it cannot be that connectivity is a luxury. It cannot be. It is a precondition for education, increasingly for work, for society, and to access health. It becomes a public good. If we lack stable internet connections or the skills to access digital tools, then we are increasingly excluded from the growing part of our civic and also our health life, whether this is telemedicine, whether it's online health information, or indeed digital welfare systems. So who is excluded? And of course the answer is the same people who are always excluded. It is the same people who have always borne the wealth of inequality, the lower socioeconomic groups, people living in rural areas, older people, and our marginalized parts of our populations. The digital divide is not a new divide. It's an old divide, but it's amplified. Digital access and digital literacy have become almost super social determinants of health. They mediate everything else. Our education systems into income, social connection, and even our trust in institutions. So when we celebrate our innovations and our digital gains, we have, and increasingly our AI-powered systems, the question really cannot be how innovative is this, but rather who is missing from our conversations within it. So if we then look at the commercial dimension, this is, and WHO defines the commercial dimension as the private sector activities that impact health, for better and for worse. As a determinant, it is modifiable. It is certainly not an anti-business agenda. And I've been asked to point to the plenary tomorrow on commercial determinants, which will talk about this in more detail. But in this digital era, the commercial dimension is more concentrated, it's more sophisticated, and it's more invisible. And digital platforms are now the most powerful marketing machines in history. They not only sell products, but they also sell ideas, they sell norms, and they sell our aspirations as a society. And through algorithm targeting, health-harming products such as ultra-processed foods, tobacco, alcohol, gambling, the list goes on, are directly targeting some of our most vulnerable communities, often children, often without due regulation or in absence of regulation. And meanwhile, some of our digital tools are indeed shaped by commercial incentives. They're built around data extraction, surveillance, and paywalls. And when your data becomes somebody else's business model, we're no longer patients or citizens, we become part of the products. So the digital environment is a new frontier for commercial determinants of health, and it requires urgent regulation, increasing transparency and accountability. And then finally, before I close, I want to talk a little bit about the political dimension, and this is very challenging to do with two former politicians on the panel who know much more about this than I. But this is also known again structurally for us in public health, of course, as the political determinants of health. And they intersect with the digital determinants in many ways. We can see digital determinants of health or digital health systems as technical solutions. They increase efficiency, innovation, and there's an inevitability about this. But public health, as public health, we know that technology is never just technical. It is always political, deeply political. Every digital system reflects political choices. Who owns the infrastructure, who controls the data, who sets the rules, and who benefits from the efficiencies. And if our digital systems are built on inequitable foundations, they reproduce inequity at scale, faster, cheaper, and more efficiently. And for WHO, digital transformation must be governed by rights-based, transparent, and accountable strategies, which means that we need to treat digital access as a public good and not a private luxury. And this means building data governance that protects people and doesn't exploit them. It means recognizing in a digital world, power over information is power over our health, and that digital transformation is a political project. And that health, as public health, we must be at that political table. So we can see how the digital determinants sit at this intersection of social determinants, commercial determinants, political determinants. They can increase access or they can deepen inequality. They can empower our populations or they can entrench surveillance. They can connect our communities or they can divide them. And it's not the technology that makes the difference, but how we govern it, how we regulate it, and indeed, how we imagine it. And I'm almost done. So digital health equity is not going to emerge spontaneously. It must be designed, it must be funded, and it must be fought for. The biggest challenge facing all of us in this room, whether we are researchers, practitioners, or policymakers, is how to be at that political table with the knowledge that we need and the skills and tools that we also need. The future of public health will depend on systems that are not only smart, but also fair. And the real question is not whether the digital transformation is going to transform health or the digital revolution will transform health. It already has. And so the question is for us is whether that transformation is going to lead to more equity and health justice. And that is not a question for the engineers, it is a question for all of us in this room. Thank you.
Now, Domitilla, can you tell us what the people are saying on the slide?
Thank you. We have received a large number of answers, so thank all of you for answering and for being part of this discussion. I would say that we have some bias because we have a public health community, so we are I mean, the most trusted, the most important source of information obviously are scientific journals and institutional sources and professional networks. So, probably we have another bias because the personal controversies that you have encountered is vaccine safety and effectiveness. We have the majority of vote on that. But we are aware of our role in the public health community and in the social community because we recognize that healthcare professionals are the most trusted messengers in our community. So we know our roles and we know probably the most important challenges. The majority of you have voted for food industry and tobacco and alcohol industries as the most strongest influence of health harming industry. And the last question regards the hardest part of communicating uncertainty, and the pressure of clear answers was the most voted option. So I think we have clear which are the main challenges and our role in this community. So we have to take our part, I would say.
Let's do that. We were just in a session with EUPHAnxt training youth professionals how to pitch to politicians.
Yes.
So, trying to do that. Going back to you for a first round of debate, and then we'll give you opportunity to ask questions. We know that sometimes we're being naive against the powers against us, and we also feel overwhelmed and helpless. So what are you taken away from how, with our small public health force, we can tackle and address those huge challenges?
I think whenever I come to conferences like this, and I was in Lisbon last year, I'm most likely the only person from my kind, quite surely the only tech person. And I come with a lot of joy because I think now I'm going to meet the people that have all the factual answers for me when it comes to health, and that are the bearers of, you know, the evidence-based knowledge, and they're bearers of what people come to see on my platform in billions and billions of numbers. And then I always, you know, then I want to be friends, and then I see, oh, there might be a little bit of a relationship issue between us. And I think if we can combine what you guys do and you guys know, the expertise that you have is ideal as a source for scaling, because it's a very fundamental knowledge that we don't have, but we have everybody asking for it. So if you give us a hand and give us the knowledge, we can surely give it to everybody, because everybody is coming to us to get it. So for me, I would strongly encourage that if we speak about digital, it always seems to be like a problem. It's not a problem, it's an opportunity that has problems within. And I think if we allow for the good, let me use simple language, for the good stuff to be part of the opportunity, the bad stuff gets weeded out. And I hope I can come much more times until I'm not the only one. And until I got a lot of the proper information and the proper knowledge from the public health sector, which has also the longest understanding of population health and how it works. And we have the strongest understanding of the digital life. And I wanted to add a point that you spoke about. I couldn't agree more, because one thing I want to put as a thought in all of your heads is, when we talk about social life and social determinants, I think during the pandemic, a generation was coming up that for the first time in the world had something that I would call a hybrid social life. So they have real, like, analog social life. Their schoolmates, their sportmates, their parents, friends. But then they also had digital social life, which might oftentimes not be the same thing. So it might not even be the same way they communicate in the two. But this is something new that we have to address.
And one thing is, you mentioned, Sanna, that politicians or scientists are attacked on social media. At least I know at least 3 researchers, I don't know if they're all the 3 here, that have been personally attacked and harassed on social media, even 2 that have been misquoted. Their research has been used by Kennedy Jr. in the US to make their point. So it's even worse. They're not only misquoted, and then they're straightened, and they're trying to get back, saying, I'm the one who did the research. So we have a big problem here. And then we talked on the conversation that you have also a financial model that is not always compatible with how university or WHO are working. So I'd like to have your opinions, both of you, on that.
I think very important is to really understand that it's not only public health professionals who can be attacked like that or misunderstood, or so it's something bigger happening, and it is threatening our democracy, and I think that's why we should really have the unusual allies, also with the industry, definitely, because I'm sure you also want to have the open society and not go back to something that is probably more authoritarian and not so democratic, because there is also a good element in the free internet, that everybody can use their voice. There is definitely good things about it, but how to really use, not to go on kind of defensive side and try to hope that hopefully we are not attacked, or hopefully we are not misquoted, or let's be a little bit not so vocal because maybe somebody uses us. And I can see that the same happens also with the civil society organizations. A lot of our funding is now being discussed also on the EU level, also in Finland's level. I'm sure in many other countries as well, civil society organizations are thought that, you know, should there be a public funding for this type of thing, and many react the way that, okay, let's be quite silent so nobody remembers us, and probably you recognize the same with other organizations, but I think it's a much bigger thing that we should really wake up and think that we're defending kind of the open society and European democracy. And then we need to work also with the industry, for instance, also with other sectors to really to have some kind of, like, I agreed everything what you said, Monika, about the principles that we should have, but we should really have a good alliance how to really defend it and work on the protective factors and how we know that that works mostly well, not to be on the kind of defensive side.
I can't hear your question to me from that side of the panel, so I need to repeat it.
What we talk about the economical model.
Oh, okay. So in terms of the financial incentives with regards to it. So yeah, I mentioned it a little bit in terms of how the commercialization and the financial or the commercial incentives which shape some of the underpinning systemic issues that are affecting what we're talking about. But to perhaps your first question, because you ask in terms of what can we do sitting in our individual public health spaces, and I think the answer is quite a lot. And there are a couple of things that I came to mind in response to that. And one is that, you know, we have a habit of thinking about these as individual responses. So thinking about this as in terms of individual behaviors of individual people, communities, but we're talking about structural issues, and that requires structural responses. And as public health, this is not new for us. This is fundamental to what public health has always been and always will be. So but we cannot do it alone. And I think it's incredibly important that we have Gigi here at the table. This is the rules of the road around what the commercial incentives are, how they operate. Gigi, you said something very important, which was that you follow the laws of the countries that you operate in, and that is, of course, your job. And that is a question for all of us with regards to we have created a system which has unequal rules of the road across different parts. Depending on where you're sitting, then determines the information that you have access to and so on. So there are some very fundamental structural issues that we have as part of it, and having a common approach and a common discussion amongst ourselves as public health that doesn't come from a place of reluctance or fear, but rather this is here, it's happening, it's something that we need to think about and tackle. But perhaps before I stop, I really think that in any of these discussions, we cannot forget the health equity component on it. It translates itself so much more into the communities that are already bearing the brunt of the harms that we're talking about. And so a plea for us that when we do discuss this as part of our agendas, we make sure that we have that component as a standard.
Oh.
Yes.
Oh, no. Okay, perfect. Yeah, given the time, I would say we should move to the end of our session. But before, I had a curiosity about YouTube and YouTube Help. Many people in the audience said they are familiar with YouTube, but not.
If you have the mic from the table, there is something wrong with your microphone, please. Okay.
Thanks. Technical issues.
Digital failure.
Yes.
It wasn't me.
All right, I was saying everybody knows YouTube, but almost nobody in the audience, me included, has heard of YouTube Health. How come that when we search for something health-related on YouTube, we're not directed to YouTube Health? Could you elaborate on that? I was very curious.
So the answer is you are. So we've rolled out YouTube Health in 12 countries, and it's the amount of languages. So the system follows the language. So if I was to type in, open my YouTube app now and type in oral cancer in German or something like that, at the top of the recommendations, if you're on the phone, usually you know the movement of your thumb, you go up and down, but at the, maybe position 1, 2, or 3, it will give you a saying, in English it would be from health sources, or from Source Medical, or from Gesundheitsinformationsquellen. And then you go left and right, and it will only show you content from certified channels based on the WHO criteria. And those are the channels of YouTube Health. So for us, it was important because millions and millions of people come to YouTube to find health information, not to have a separate platform, but a functionality on the platform. So YouTube Health is not another shop. It's in the same YouTube that you know and that you use daily. And whenever you touch health topics, then I will come into play, and I will surface to you the proper evidence-based health information and have it indicated. So that's why, and we didn't do advertisement around it, we just did it. So if you search for something medical, it will appear depending on the language that you use. And then you never made up your mind, and it will not say YouTube Health, that's just what we do.
That's great, thanks for the answer. That's even better if it's not flagged that it's official health information. I think that might, for some people, they might be more reluctant to see it. So cool, thanks for informing us about that.
Maybe I can add a little bit based on what we spoke about, and because now I'm here with all of you, is what we oftentimes see that communication and information is two things that need to come together in order to be, powerful. And some of you might be teachers, professors, or, lecturers or politicians that have to speak and convey a message. And conveying health information is a very sensitive topic because it's very personal and maybe so threatening also. So what I often observe is that the most authoritative in terms of clinical expertise and organizations are oftentimes the least engaging to convey the message about it. So I think there is something to be learned from people that are very well in communicating information, because then it becomes much more stickier and more trustful. And we always say health moves at the speed of trust, and I would say trust moves at the speed of the relationship. And it might, it might be a personal relationship, might also be the relationship that you have to an institution or a science organization. And I think it's something that we all have to understand, that we are now in a communication age. So communicating skills have become even more vital, because if we just speak among ourselves, and the survey shows it, medical journals, I hate to break it to you, but that's not how the public informs themselves.
Do you want Sanna or Monika to add something?
Yeah, I could add also, people really want to meet each other as well, so we are still social animals in that sense. So I think at the same time as we understand that the world is very digital, and even in our work we see there are a lot of benefits. I was mentioning to Gigi earlier that, for instance, the AI, artificial intelligence, that brings us people who, for instance, have suicidal thoughts, and they are guided to our help services. So there's definitely positive elements, but at the same time, I think people also we need to strengthen the social ties. We need to have places where people meet each other, and really then hear what things, kind of citizen-led initiatives or citizen-led thoughts there are, because if we only do it from the kind of professional level or from the financial or company guided way, it's not what really hits the ground. So I think at the same time, really to strengthen the community level things, very important ones.
So I will end with suggesting that anyone who wants to look at what WHO does on this more broadly, you can find it on the WHO Geneva website, but also there's a lot of fantastic work here in the WHO European region from my colleagues in Copenhagen. And for some of the commercial dimension that I mentioned, next year we will publish the first ever global report on the commercial determinants, which does look at the digital environments and some of the issues that we've spoken about, including social media and others. So watch this space, and thank you very much for being here.
So would like to finish with some points. One is quoting against this report. You can see more of it at the WHO booth. Consequences of all the atmosphere. People, healthcare professional, as it's shown in this study, are not doing well. It's hard for everybody. We need connection and we're disconnected. It's polarized and it's really hard on everyone. It's also very hard on civil society. The disinvestment we are going through, the fact that NGOs are being killed by political will in all Europe, not only in the US, is really something hard. Lots of us, as civil society, we had to let people go. A very important NGO, Eurocare, just closed their door because of the disinvestment. This has consequences, and yes, you need to communicate, but then if we cannot hire anyone, how do we communicate? How do we do it well? So we really like to ask you, how are you? And share this communication video we did with public health professional.
Public health is not an abstract idea. It is the invisible shield that protects us all, every day. But facts and data can be twisted, science ignored, and disinformation can spread. And so, trust erodes. When civil society is silenced and the funding that sustains it disappears, our collective shield weakens. Evidence fades, community voices are lost, and democracy itself is left more fragile. When this happens, health is not guaranteed and the most vulnerable are left behind. In every country, in every city, and every village, health is a human right we must secure. We cannot let the foundations and values of public health melt away. Together, we can keep civil society strong. Together, we can stand for science, for equity, for public health.
We didn't want to stop with no structural, concrete call to action. Last year, I saw a report on those farm bots of, especially in Russia, spreading misinformation. 70% of what we are seeing in the internet is not by human, is by bots, and lots of the hate is coming by bots, but we're not doing it. So the first name of my project was Love Bots. So instead of hate, we spread love and science. I talked about it, like I do, and then we found partners. So we're really happy to say that we're officially launching tonight a European coordination platform to detect and analyze health and misinformation, coordinate trusted public health response, support national public health associations, institutes, management, public health school, all of those that want. It's a network that is a public good, build capacity. We need capacity, we need skills, and strengthen our preparedness. We're launch partner, it's EUPHA, it's WHO, it's PGP, Public Good Project with Infodemology. And last week, I learned that we are laureate of a Data for Good call for action that was, really last minute. And we have 5 developers, geek person, really scientific people that are going to work for us in the next 5 months. What we want is to build it with you so that this platform will show the trends, show the answer, draft the answer, and send it directly to the trusted messenger, NGOs, community, people in the countryside, cities, so that we can act together in coordinating campaigns and do better than just reposting statements. So you have the email, join us, so that together we can stand for public health. So this is my last question, and it's not a Slido. Do you stand up for science? I do. Do you stand up for public health? Do you stand up for democracy? Do you commit to act and fight against all these political, social, commercial determinants of health together? Thank you. Have a very nice evening. See you tomorrow.
Thank you. Very difficult to hear. Very good. You did an amazing job. Really. But the thing is, I agree, and every